Hi, I'm Dr. Melissa Turner, and I'm happy to be talking with you today.
What kind of doctor are you?
I'm an internist. I'm the kind of doctor that your parents go to when they're feeling sick. I'm kind of like a pediatrician for grown-ups.
What do you do?
I work at the VA, so my patients are people who used to be in the armed services, used to be soldiers and Marines and people in the Air Force and Navy, and they've left the service and come to the VA for their health care.
Why did you go into medicine?
Well, I went into medicine after working as a journalist for 4 years, and I loved learning about people when I was a journalist and asking them lots of questions, but I did not feel like I was helping them much. So I went into medicine in part to be able to help lots of other people, to get to know individuals I wouldn't otherwise meet, and to learn a lot. I've always liked science, and it's fun to incorporate all of those interests into one profession.
What do you like about being a doctor?
I really love taking care of people, getting to know them, helping people understand and do some problem solving on their sicknesses, on things that bother them, and to help explain what the sicknesses are that they are experiencing.
What's hard about being a doctor?
One of the hardest things about being a doctor, I guess, is taking on the responsibility of just helping people through their illnesses. There's a lot of work involved and lots of communication, and but it's also one of the most gratifying things. We have a lot of long hours, so it can be kind of hard to balance work life with family life, but it can be done.
Hi, I'm Dr. Eric DeYoung, and it's good to talk with you today.
What kind of doctor are you?
I'm a geriatrician, which means I'm a medicine doctor that takes care of elders, generally people who are 80 years and above. My oldest patient was 113 years old.
What do geriatricians do?
Well, I make house calls, and I also take care of elders in the hospital and in senior community. So I work with a team to do primary care, where I take care of all of their complex medical problems and try to help them stay at home until the last day of life.
Why did you go into medicine?
I went into medicine coming out of college mainly because it was kind of the highest challenge I thought I could take on, both from a science perspective, from emotional challenge, and also intellectual challenge. I kind of tried to aim as high as I could.
What do you like about medicine?
I really like being able to establish a relationship with patients and their families and make a difference for them in the kind of greatest time of need in their life. But I also like working as a geriatrician to help change the system, to change Medicare, which pays for healthcare, to try to help more people be able to get care at home and live their lives with dignity.
What's hard about being a doctor?
I think one of the hard things, especially about being a geriatrician, is there's some times where you're trying to solve all these hard problems and make diagnoses and do treatments, but you can't always solve everything. And you might come to the point where the patient may be at the end of life, and you just have to help ease their suffering and be present with them and their families in that final time. That's both hard, but it's also one of the best things about being a doctor, is that you can be present in those moments that are in some of the toughest times of people's lives and make a difference for them.